Okay, now we're going to talk about training somebody with a knee injury. Being a weight-bearing joint, the knee is pretty susceptible to injury, and it's actually pretty much one of, if not the most commonly injured joints in the body. Now, the first thing I'd do if I was going to train somebody with a knee injury is just get that medical clearance first. That's really important just to make sure they're okay to train and that we know what we're dealing with the injury. There are two types of knee injury generally. There's an overuse injury, which is, it happens over time. It's a result of wear and tear. Examples can be osteoarthritis or what's known as runner's knee. Then there's the acute injury, which is something that you feel happen. It's kind of an immediate pain or swelling. There's an incident that causes it. These can be an awkward movement, a twisting injury, tearing a ligament or your meniscus, something like that. The treatment options for knee injuries, severe ones would run from surgery to cortisone injections, physio, rehab, at the very least your RICE, your rest, ice, compression such as strapping or bracing, and then there's the elevation or immobilization. Now, high impact movements like jumping, twisting, rapidly changing direction like a footballer would do, or agility exercises encourage, excessive range of motion, all those things, they'd be contraindications for exercise for somebody who's got a knee injury. And as such, we'd adapt their training program to avoid these. We want to reduce impact and reduce or keep limited the range of motion. You could substitute a wall slide for a squat, for example, or have them do a low impact step up instead of a box jump. I'd definitely avoid certain exercises such as what we mentioned before, the jumping and landing, twisting, changing direction. Any of those high impact exercises would be out, as would full range of motion squats or lunges too. We'd want to avoid them. Stretching and strengthening the muscles surrounding the knee joint are really important when you're dealing with a knee injury. Exercising the muscles such as quads, hamstrings, calves, abductors and adductors, all of these are going to increase stability of the knee joint, making the knee stronger and less susceptible to injury in the future. Leg flexion and extensions and other isokinetic exercises will also help. Now, you can do all of this like with a TheraBand or in the gym with low impact weight bearing exercises to isolate the muscles while keeping an eye on that range of motion. And even something as simple and as common as pedaling on the exercise bike, the stationary bike, is a good way to increase strength and range of motion and maintain or recover mobility when you've got a knee injury.